Since then, we have grown to become a Ministry of Health recognized day surgical center. And to date, LEC Eye Centre is the largest private group practice in Perak with 4 consultant eye surgeons.
LEC Eye Centre is a one-stop comprehensive eye specialist centre, and we're able to cater to all the eye care needs of our patients. We pride ourselves in having the most advanced technology to provide the best outcomes for all our patients. We have premium cataract surgical services, and this involves the acquisition of the first Lenstar optical biometer in Perak, which is actually a laser machine used to measure the eye before cataract surgery. We also have another advanced machine called the Varion Image Guided System, which is actually a precision machine that provides digital marking during cataract surgery. Now, aside from this, we also provide retinal services, and this includes the management of retinal detachment, age-related macular degeneration, and diabetic eye disease. We acquired the first in Malaysia sweat source OCT angiogram, and this actually allows us to take high-definition images of the retina and better manage these diseases. We also want to make sure that we are always accessible to all our patients, and they can make appointments to see us with a click of a button via our online appointment system.
At LEC Eye Centre, we have our in-house optometrists who are vision care experts responsible for accurate testing of spectacle power as well as contact lens fittings. They also provide vital support to our LASIK services. At LEC Eye Centre, we acquired the first in Asia wave-like refractive suite in 2011. One of the fastest lasers in the market, this unique all-in-one suite connects the machines used to measure the eyes before surgery with the laser machines, so all treatment information is sent wirelessly and allows surgery to proceed seamlessly and with unparalleled precision.
At LEC Eye Centre, we recognize the increasing problems of nearsightedness or myopia amongst children nowadays, and we have in place a myopia control program to combat this. This program involves the use of myopin and eye drop, which has been found to be effective in slowing down the progression of myopia in children. So this program aims to increase awareness about myopia and allows our team of doctors, optometrists and nurses to work closely with parents to manage this epidemic which is sweeping the world. A key component of this program is the use of appropriately prescribed eyeglasses, for which our subsidiary company, Eye Care Optical, will be able to provide. Aside from children eyewear, a wide range of adult eyewear is also available.
unmute yourself, Anna. You're still muted.
Hello. Thank you, Dr. Lee. I was talking to myself there just now.
Exactly.
Good evening, everyone. Thank you for joining us, spending your precious evening with us. I hope everyone had a good and pleasant dinner. So we do have quite a number of people joining us from our Facebook Live as well as our Zoom session. So advantage of our Zoom session, they can have direct interaction with our doctors later during the Q&A. So without further much ado, so let me, because today's topic is about, I will appreciate those who are joining us in Zoom, to mute yourself during the session so we will have minimal interruptions. So for those who have questions, you may post your question in the chats. As well for our live session viewers, you can post your question along the way during Dr. Lee's presentation. Okay. So let me have a brief introduction of Dr. Lee. Thank you. So Dr. Lee is currently our medical director in LEC, and he actually graduated from University of Manchester. He had his ophthalmic training in Singapore National Eye Centre, as well as he had his retinal fellowship, which is a subspecialty at the Lions Eye Institute in Western Australia. Dr. Lee is also a current visiting consultant in Para Community Specialist Hospital as well as KPJ Ipoh Specialist Hospital. So today we're going to discuss and share about the topic, Help My Children Need Glasses. I believe this is a pretty interesting topic. We still have a lot of people admitting in our Zoom session. So let's welcome Dr. Lee.
Hello. I think we give a bit of time for people to come in.
Yeah.
We could say 8:30, another few minutes. So I hope everyone is well. And to all the attendees, I think some of you have attended webinars from our LEC before. So I see some familiar names. And to those who are new to our webinar series, welcome. And this is something that we've been doing for almost a year now. Is it, Anna?
Yes.
I think the COVID pandemic has changed a lot of our practices. I think not just at work, but also personally. And I think aside from being so very much used to us all wearing masks, I think most people are used to staying at home and staring at a screen now. So there are good and bad things that have come out of this, obviously. And one of the good things is we have learned how to adapt and reach out to a lot of our patients and our friends and other public members where we can actually share information and create awareness about eye problems. So, like as Anna mentioned, I think the Zoom session will, of course, give us more opportunity to interact directly with the attendees here. So I think all of you are welcome to turn on your cameras. I think you don't have to be camera shy. I think we are at home, but
Don't start now.
we don't have to be completely well dressed. But turn on your cameras if you like, and later on you can take a group photo, which you normally do right at the end anyway.
Yeah.
And for our Facebook and YouTube attendees, also welcome and thank you for joining us. So please also post your questions in the Facebook chats and the YouTube comments, because some of our people are monitoring and they will put those questions to me or to us in the Zoom group, and we can talk about it and answer questions that way as well. Okay, so I look forward to a lively discussion afterwards. And today's topic is something that I think it is important because we are dealing with the future in terms of the future of our generation, of the next generation, shall we say.
Yes. In fact, now more and more children are having this problem with their glasses. I mean, with their visions.
Yeah, of course. I think it's very easy now. You take a little stone and throw into a primary school or secondary school, you're going to hit somebody that's wearing glasses, I'm sure.
Yeah. I guess it's more like a lifestyle, problem, right, Dr. Lee?
Well, we will
I mean,
discuss
compared to
more
our
what.
time, not that we are very old.
Yeah, I think it's definitely related to a lot of the changes of the world. And afterwards, we can discuss about who we can blame for this. We can blame at technology advancements, or we have young people in here as well. We can ask the Gen Z, or whatever you call them, the millennials, what is the cause for this close relationship we have with technology. Okay, I think in 1 minute we shall start. I think we've got quite a few people on board already.
Yep.
So just 1 more minute, I think we will start, and then whatever, those of you who are in here, if you think that there's something useful that you want to share on, I think afterwards you can just share on this video will be available, or rather this session is going to be available in our Facebook. You can share it on, people can listen on as well. It's always going to be in the social media. Yeah,
in fact, for those who are viewing from our Facebook, they would like to share to their friends who did not register. They're viewing from Facebook, they can actually share or tag their friend in the chats so that the friends will actually know that this session is actually on. So because
good,
tonight we have a quite interesting topic talking about.
More people can reach out, the more we can actually discuss, and more people will be aware of the problems of myopia.
Yeah.
Okay, I'm going to start now. So once again, thank you all. So I'm going to share my screen and talk to you for the next half an hour or so. Okay. Just to make sure that you can see my screen. Are you all seeing my screen?
Yes, can see your screen.
Okay, wonderful. All right, so today's topic, I think, something that, oops, just a reminder, somebody, can you all please mute your microphone so that we can actually have less feedback. Sometimes you get a bit of feedback. Okay, so today's topic is going to be about glasses and children. And today also we have the opportunity of, I would like to say, I'd like to thank our sponsor, I think Alcon. I think if you see down here, Cysteine is actually a type of dry eye drop, and Alcon has very kindly also helped us in starting this webinar. And I would like to offer our thanks to Alcon, which is a big eye provider company. They make all sorts of eye drops and lenses and everything. Hold on, just let me advance my slide. Okay, for those of you who don't know us, I think there are quite a few new names in the actual Zoom platform here. So LEC Eye Centre has been around for 47 years now, coming up. And we are now a Ministry of Health accredited day surgery center, and we look after eye care only. So we do our surgery and everything inside. We provide everything in terms of outpatients, and then we have investigations that we do a lot of, and we also have our own operating suite, which is on our first floor. So we have 4 dedicated floors for eye care. So this is just a few photos of our room and our ward area in the first floor. And this is an operating room. So we have 2 of these. And the bigger picture here is actually my colleague, Dr. Lim. I think he's also in here. Hi, Dr. Lim. He's actually operating there. And this is me on the right side also operating. And those of you who have not seen how a setup of an operating room for eye, it looks like that. So we are looking through microscopes as we operate. So afterwards, we can talk about this later. So we do cataract surgery. I think that's very common. We use a lot of different advanced instruments and make sure that technology is up to date. So I know you have a lot of digital image guidance and a lot of sophisticated things that we do for cataract surgery. Myself, as you heard earlier, Anna mentioned, I've also done subspecialization in retina. So I look after retinal diseases as well, those that are listed here. And we also do LASIK. So LASIK is laser vision correction. We have the Wavelight suite, and we've got the first and only one, which is still available here. And it's a very good platform that we have been tried and tested for a long time now, and we continually having upgrades to this platform to deliver the care that we want. And we also have this advanced scanning machine, which is like a sophisticated laser scanner to look at retina and different parts of the eye, diagnose problems. We also have a few optometrists, which are specialists in vision care, and they look after glasses and contact lenses. And eye care optical is something that we'll talk a little bit more about today, because it is a service that we've been providing for a while, where our patients get to make their own glasses as well. And this is particularly relevant to today's topic. So we'll talk a bit about the kind of glasses that you may actually have there. So as I mentioned, I am the medical director here. So I'm in charge of all the medical things that happen at LEC. I'm an eye doctor, and this long word that's ophthalmologist just means an eye specialist. I'm also a retinal specialist. So today, I decided to talk about the problem with children and glasses, is because now we have endured and we are still enduring a pandemic in the name of COVID-19. And really another pandemic, if you call it by definition, is actually childhood myopia. I'll explain why I say that it is a pandemic. So what is myopia? It's something where actually nobody wants to wear glasses, right? But actually now we know that a lot of people have it. And not many people know that why is it important that we know about myopia, and how is it going to affect us, because it's affecting children at a younger and younger age. So it's not uncommon now to see this very cute girl that may need glasses. And in the local terms, myopia is more of a medical term. So people will talk about nearsightedness, which is actually more accurate than short-sightedness, because it's actually talking about distance. So it's near and far, rather than height is short and long. But anyway, over here, everybody is used to saying short-sightedness, so we can refer to it as that. So how does the eye work? So essentially, our eye is like a camera. And this, is an old-style camera, not the kind of cameras we have now in our phones, but an old-style camera where you have a lens system which focuses everything on the film, and everything then gets transmitted in the eye actually to the brain, and the whole thing forms a visual system that goes from the front to the back, and that's how we see. So in a normal eye, if you look at this is the cross-section of the eye. So you imagine, like, if you take an apple, you cut it in half, you look at it from the side. So my arrow here is showing you this is the front of the eye, this is the back of the eye. So if you're looking at an object, everything that actually comes into focus very accurately on this back part, which is the retina or the nerve layer of the eye, that's when everything is seen clearly, as in this image here. So if you have a myopic eye or somebody with myopia, the eyeball actually is a little bit longer. So the front to the back looks a little bit elongated, so it's a bit longer. So everything actually gets focused in the same way, but it falls short of where it should be, the focal point. So what happens is people with myopia will see near objects clear. That means they can see near things without glasses. But when they look into the distance, they will find that it's blurred. And typically that's what happens when children get found out when they're in class. They actually cannot see the whiteboard properly, or they copy things wrongly, and the teacher noticed some problem. So why is myopia important? Now, this is a graph or a chart here from an institute in Australia that's done a lot of research in myopia. Afterwards, I'll share. They have a myopic calculator as well, which is very useful, that I use to explain to some of my patients' parents. So over here is a bar chart that's showing from the year 2000 on the left here, and going up is like walking up steps. It's quite kind of regular increase in the height. So they're talking about in 50 years, they are projecting how the trend of myopia is going to progress in the world. So you look in year 2000, they are predicting worldwide 22% of the individuals are short-sighted or myopic. And by 2050, you're going to have more than double that number. So you're going to reach half the population of the world. And this is their projection. So how did they arrive in this? Obviously, they've looked at surveys all around the world, and they've looked into the data. And this was actually in 2016. So the numbers could be even higher. And also, this is again looking at the map. And you look, this is not a problem just unique to us in Asia, but it is, if you look at the percentage of people that are myopic, a problem that is more prevalent or more common but it's not just us that gets it. 65% of East Asians, which is us in this part of the world, have myopia. And you see in US it's 58, South America 53. So these are still high numbers. Now look a bit closer to home. There's a big study that was done in Singapore, and they looked at the different ethnic groups, which is very similar to what we have here, the Chinese, Indians, and Malays. And this was actually quite an old study. It's gone up to 2010. But it did also show that from the 80s all the way to the 2000s, over a 20-year period, the myopia is also climbing. Whether you're Chinese, you're Indian, or you're Malay, well, the short-sightedness is going up. And in this instant, the Chinese seem to be actually winning the race in terms of, you see the light bar here, almost 90% of people in Singapore are myopic. That's a lot, isn't it? So why is this happening? So they're calling it an epidemic. This has been reported in the LA Times here. They're talking about a lot of people in East Asia, which is China, they are nearsighted. And this is another news report. This one is NUS is in Singapore. They're talking about epidemic. They are all quoting these terms, epidemic, and I mentioned pandemic just now. So what is an epidemic? An epidemic actually refers to a disease that's affecting large numbers of people in a population of one region. So you can say it's an epidemic in Malaysia or in Southeast Asia or in Asia. But when it becomes a pandemic like COVID-19 now, it's actually a disease which is epidemic, but it's gone all over the world. So that's why I say that myopia is a pandemic. But it's just a term that's coined, but it's not a true sense of the word, because right now you can argue whether you can call myopia an eye disease, because it's not something that it's literally going to make everyone blind, or like a disease like glaucoma or some other retinal disease, but it is something that could lead to other problems, which I will share later. So I think it's important to give it some weight by calling it something like a pandemic, because it is spreading, or it's getting very, very common very quickly. So why is it happening? So I like this little photo here, because it typically shows a few things. You have a little baby here that's wearing a pair of glasses, and what's in front of it is a laptop, and you can see that the age of this baby is probably not even close to even a year old. I don't think he can walk. Maybe it is maybe about 12 months, and not verbal, but he probably knows how to operate a laptop quite well. So our children nowadays are more than likely to be able to operate a digital device even before they know how to talk, because the interaction or the closeness they have with technology is introduced, unfortunately, by the parents, by us, at a very young age. And that is actually no thanks to the tech moguls, or you call them that, the late Steve Jobs, of course, and Bill Gates. We all know Microsoft and Apple. But they do know that, despite making their names or making their fortunes in this technology world, but if you look at this article here, I think it's one that was reported last year only, that for their own children, they actually limit the usage of tech, because they're actually aware, of all the problems that are associated with tech. So the fact that Steve Jobs, who created the iPhone, the iPad, he won't let his kids use it. And Bill Gates, one of the most influential tech leaders, will limit how much technology his children are allowed to use at home. Now, why do you think they want to do that? Because they realize there are dangers associated with that. However much our lives are now very much affected by technology, I think we do need it, but there has to be some balance as to how we let our children use it. And this is one of the worst things that can happen. And I find that it's a bad thing. And as a parent myself, I definitely do not advocate and do not allow my children to actually have a phone at the dinner table or at the meal times, because that's something that will, firstly, be bad for their eyes. Secondly, just takes away all the social interaction that we're supposed to have around a dinner table. We should be, either eating or talking with the family and getting to know about each other's days rather than staring at a phone. So don't do this. There are some genetics involved. So genes of myopia, so there are links about potential hereditary things. So genetics is there, but it's quite complex. I think there's no fixed marker that definitely says that, there's a gene for myopia, and definitely if you have this gene, then you're going to get it. But basically, looking at it, it's common sense. If I see a father who's got wearing glasses, short-sighted, a mother who is also short-sighted, it's a good chance that some or maybe even all of their children may end up needing glasses as well. As I mentioned, the Chinese win the race. The East Asian descent are more likely. Now, we don't know why. That's probably a genetic element. There's probably an element in the way that Chinese tiger mummies and tiger daddies push their children in terms of education as well. So a lot of studying, they might do that. So how do you find out if your child is myopic? If you see your child holding things up very close to their face, or when they're watching TV, they walk very close to the TV to be able to see well, or sometimes it can be a simple thing as blinking. It may not mean that they're myopic, but it could indicate that they can't see well, because children don't know how to tell you when their vision is no good. They might squint, they might tilt their head to look at things. So it's all quite subtle things, because a child is not aware of what is so-called normal vision. So they're not going to tell you, mommy or daddy, I can't see. They won't say that. It just might be like tilt their head or squint their eyes, things like that. So pay attention to that when you interact with your child. So what then if you notice this? Of course, the simple thing is to check whether they need glasses. So you either go to an optometrist, or you can go to an eye doctor, an ophthalmologist, and then get an eye test and find out whether actually they do need glasses, or maybe it's something else. It could be something like an allergic kind of reaction. It could be the fact that they got infection in their eye, they're blinking, things like that. So at least get tested like this to make sure that they don't need glasses. Now, one thing I want to just spend a couple of slides to mention about this is a medical term. We call it cycloplegic refraction. So that for those of you who have young children, usually below the age of 12, maybe 10, where we may, if you bring it to an eye doctor, they may say to you that your child needs to have some eye drops before we can actually test the power. And this is not something that anybody else can do. This way of testing for the power is only allowed, so to speak, because we need specific eye drops prescribed by the doctor. Now, why do we do this? Because children have got very strong accommodation. Now, what is accommodation? Just now I showed you a picture of the eye. Oh, excuse me. So what happens is when you look at something distant, so there's actually some muscles. This ciliary muscle is actually a muscle that helps to change or focus the image that we see. And what happens is when we try to read, or when we try to look at distance, this muscle is actually helping us focus. So when very young children, this muscle actually is very strong, and it can actually focus too much, and they can give us a false high reading or high tested power. And if you want to make sure that it's accurate, then what happens, we always put the eye drops to relax this muscle, then we can do it accurately. So that's why we do cycloplegic refraction. And we know that usually above the age of 10, maybe 12, we'll find that the muscle is not so strong anymore, and we can do the testing like we normally do. For those of you who wear glasses, you go to the optical shop, they will just put these frames, or they put you in front of a machine and they change the lens and ask you whether you can see. So that's the principle of doing it. But in children, we add eye drops to relax the muscle before we do that. So that is the process. We do a quick test of the power, put some eye drops, wait for the muscle to relax, which can take a little while. Then we test the power again, and we see whether there's any difference, and then we prescribe the glasses. So that's just so that if you do come and see an eye doctor and they say that you need to have the eye drops, you won't get too surprised. So make sure if you bring a young child to see an eye doctor to test for glasses, allow a bit of time. You might need at least an hour or two to actually get the testing done accurately. So why am I spending so much time talking about myopia? Why? Because when the power goes to high levels, so when you talk about high myopia, you're talking about powers of short-sightedness beyond 600 degrees. So when you go beyond that, it's not that they get problems straight away, is when they get towards an older age, let's say when they're in their 40s, 50s, 60s, they get a slightly higher risk of developing all these problems here. Sight-threatening retinal damage, which means you can get retinal detachment, you can actually get thinning of the retina, and you can get bleeding in some of the blood vessels because the retina is thinned out so much. And it also increases the risk of glaucoma. Now, all these things here are potentially blinding. And that is why myopia is so important, that now we realize that it is something that we have to deal with now.
Otherwise, our children may suffer in 30, 40, 50 years' time. So this is an indicator. I'm going to just quickly click. And if you can see, this is the myopia calculator that I was referring to from this institute. So this is what I use now to explain to my patients' parents. So if you look here, we are Asians here. We try to use a way of controlling the myopia. So if your child is 8 years old, for example, and you have a starting power of 200. So afterwards, I'll talk about control methods. But over here, if you talk about, let's say we're using this called low-dose atropine, I'll talk a bit afterwards. But essentially, this chart will tell us if we have some way of controlling the myopia in the green bar, then from about 150 degrees, from 8 years old to 17 years old, the likelihood of them progressing to very high levels is less. So it goes up to maybe up to a maximum of about 400. But if you don't have this way of controlling, you're not actually trying to actively control your child's short-sightedness. It has a risk of going all the way up to about 700-800 degrees when they're 17. And this is just an estimate. And this is not data that's plucked from the air. This is data that they actually has got from a lot of research, and they try and put it in a graph form so that we can use it to explain to the parents the importance of this problem. So I like to use this website to explain to a lot of my patients' parents, shall I say. So now you know, okay, so I've talked about how to identify and now what's the problem with it. So your child is myopic, so what happens now? Does it mean that, oh no, doom and gloom, my child is going to go blind or something? No, not necessarily. It's not that bad. You can still control it. So they definitely need glasses, because particularly when there's a young child, they're not seeing well. If they're not seeing well, first thing might affect their performance in school, their academics, and how they're actually learning. If they don't see well and their brain is not mature, and what you might end up with something called lazy eye or amblyopia, whereby the brain doesn't know what is normal vision, what is blurred vision. So if you leave the child seeing blur all the time, then what's going to happen is the brain thinks that's normal. So by the time it hits the age of maturity, 10, 11, 12, and then you can't change that anymore. So it becomes fixed. So you don't want that. You don't want the lazy eye. So the child needs to wear glasses. So forget about the myths that you hear about the fact that, the more glasses that you wear, the higher the power goes. It's not related to the glasses. It's related to the other activities. It's related to the phones, to the iPads and all that. So you need to tell your child to reduce their near work activities. You see, I'm not only saying to stop the phone or stop the iPad or stop the computer. You just have to also remember that I have parents that actually say, I've not given them the phone anymore. I don't let them watch TV too much, but they're still getting more and more short-sighted. Then you find out that, because they cannot read, cannot actually look at the phone or look at the tablet, they give them a book. So they love to read now. So they're reading all the time. And the reading itself is a near activity, and that will also increase your myopia. So that's the dilemma. So what do? You can't read a book. You can't look at the iPhone. You can't look at the iPad. So you have to balance everything. You don't want them to actually go on for hours on end, moving from one near activity to the other. So it's typical now for a child that will actually have homework from school. So they do their homework, finish their homework, then they have to go for tuition. They go for a tuition center, spend 2 hours there doing more work. They come back and say, okay, I can relax now after dinner, then relax. What do? They look at their YouTube, or they look at their iPad, watch a movie. So the eye is constantly bombarded with activities. That's what makes the near or short-sightedness go up. So you've got to encourage outdoor activities. So you introduce sports or swimming or some sort of outdoor thing that they will take them away from all this near-focused activity. And of course, there are certain things that we can do, and there's an eye drop that we can use to actually control the myopia. Contact lenses has been mentioned, and I will mention it in brief because I think it's probably not the best way of doing it, but it is a recognized way of actually controlling myopia. And there have been studies that actually in this one I just quoted that they have looked at all the different ways of controlling myopia with eye drop, with contact lens, with glasses, with different types of glasses. And they find that the most effective intervention with pharmacology means that it is actually the eye drop that works best. Doesn't mean all the rest don't work. They can work, but the eye drop works best and has the least side effects. So if a child needs to wear glasses, one of the questions would be, do they need to wear it all the time? I think I already mentioned that they do. so that they can see well, and it's not the glasses that makes the power go higher. So wear the glasses all the time. Do you give the full power? Again, depending on whether there are any other eye problems, most of the time we do. There's no benefit in underpowering the glasses. I think there are some schools of thought, some people that say that, oh, we don't give them the full power so that the power doesn't keep going up. It's not proven that that is actually a good way of doing it. So we want them to see well so that they can actually function better without, rather than half power and then they half blur and then not seeing so well. No benefit there. The type of lens, we can talk about that a little bit more, but at least something that will give them a clear vision. So it's a single vision lens. We'll talk about a myopia control lens afterwards as well. And what type of frame? The more important is something that fits well. So correct power, correct fitting, lenses, frames which are durable, because children are not going to look after your glasses well. So parents, please don't spend thousands and thousands on expensive frames and things like that, because children's power, if they go up, you have to change the lens, one thing, but they might break it. And that's something that's not practical as well, because children are bound to actually not look after their glasses well. So there are different types of coatings, and you can actually make all this kind of bifocal, multifocal, progressive. Believe it or not, there are this being used for children as well. And as I mentioned, myopia control lenses. So this is our own optical shop. It's just actually a little way down from where we are at LEC. We are actually about 4 or 5 doors away. And just take a little walk down there. And this is one of the glasses that we carry. If you saw one of the earlier videos that we did earlier this week, they did show some of the glasses that are very durable. I'm going to play a little video.
Introducing EBC Eyewear Flexi Premier Series. The power of flexibility. Built with specially formulated materials. Tough enough to take on any unexpected surprises. Light as feather. Strong with purpose. Fearless in extreme conditions. Rigorous testing and refining to create the most durable eyewear. No adjustment needed. Asian fitting nose pad. Personalize your flexi style. Experience it. Flexi Premier. Durable, comfortable, forever.
Okay, so that's just that's one of the lenses that we actually, one of the frames that we carry at our eye care. Why I'm just mentioning it is because it's been quite a popular one in terms of, they have adult and children as well, and it is very durable. I think you try to twist it around, it does not break easily, and I think it's something that fits well for the children, for the child, because they are not going to look after it that well. Now, the other thing I mentioned is myopia control lens. Now, why do we have myopia control lenses? Because these lenses are a bit different from the standard single vision type lens. So, of course, this is one of the brands that they also have. And what they actually essentially do is have some slight changes in the power of the lens. So you have the lens that fits in the frame. And the single vision lenses is when the whole lens actually has the same power. And that means that you can just see clearly with the correct power, of course. The myopia control lens will modulate or change the power a little bit when you actually look down the lens. So in a way, it's like a progressive or a multifocal, but it's not exactly the same. It's made in a different way. And the reason for that, I think this is another one from Essilor. Essilor is the big company that makes lenses, is because we know that what stimulates the actual power to go up in short-sightedness is when they do near work. So they have to do near work with reading and all that for their learning. But with these glasses on, with the power that's changed, it actually reduces the effort that the eye, that means you're not using so much of the muscles to focus near, and it doesn't stimulate the eye to grow longer and make the power go up so much. So that's what myopia control lens, the principle is. Many different types. The ones that we have been using is this Pentax one in the Essilor, and there are also others as well. So if you are thinking about glasses for your child, I think you know we can tell you more about it, or my colleague at the eye care can also tell you about it. Now, a quick word about contact lens. So contact lens is also a recognized option of controlling myopia. And one of the popular ones is called orthokeratology. It's a bit of a long name. Ortho-K lenses is typically what they call. And they're actually lenses that will shape your cornea, which is the front part of your eye, because it's something that's designed to actually wear when you go to sleep. So you have to learn how to manage contact lenses for your child and put them on before they sleep, and they sleep with it. And then they wake up and they take it off and they go about to school and do their own thing. And they can see without the contact lens then, because the actual lens shapes the cornea to the correct power so they can get it focused. The problem is when you have contact lens and you have something, a foreign object on your eye, there's a risk of infection. It's not a very high risk, but when we've been in practice long enough, you actually will see problems with contact lenses. In fact, afterwards, I will share the following webinar that my colleague Dr. Lim is going to talk about contact lenses and some of the problems. So these are the complications. And these are patients that we've seen where you get allergic reactions, then you see the eyelid all getting these little bumps. You actually can get a scratch in the front of the eye. This is the eye that's stained with a bit of the yellow dye so that you can see where the scratch is. And the worst is you get this. This is actually an infection. You see the eye is very red and raw. This is actually pus on the surface of the eye, and this is potentially blinding. So these are uncommon, but something that can happen when you wear contact lenses. So it's something that you need to be wary of, especially for children, and you've got to manage the contact lens for them. So we tend to use eye drops together with the glasses a lot to manage myopia. Earlier on, when we played the opening video, you saw my colleague also, Dr. Umi, was talking about myopia control program. That's what I'm going to spend a bit of time to talk about now. So this myopin or this atropine eye drop is not new. Atropine has been around for many, many years, and we use it because it actually relaxes that muscle, and we find that it helps in controlling myopia. But the problem is finding the right dose. So the study that first came out with a workable dose was this 0.01%. And this study has shown that it has worked to control or slow down the progression of myopia in children. So this is a little leaflet on our center, tells you a bit more. And essentially, we use the eye drops. It's called myopin. It's atropine 0.01%. This is manufactured in Singapore, I believe, and we have it here. It's not something that the pharmacies can sell because we need to actually give it to the correct patient that needs it. We can't use it for everybody, so the pharmacies don't have it. Only the eye specialists will do. And this myopia control program is essentially based around the use of this myopin eye drop, and you use it only once a day. So it's not something that you need to use it frequently. It's just usually I recommend using it once a day before sleep, before the child sleeps. So one drop in each eye. And besides that, you give either standard eyeglasses, which are the single vision power, but more and more now I find that more parents are interested in using the myopia control glasses, because together with the myopin eye drops, they can give better control of the short-sightedness so that it doesn't progress so quickly. Now, we talk about LASIK. Why? Because we're coming to the end now. We'll talk more about, I'm sure you have lots of questions about this myopia control program. But LASIK is something that very typically a lot of my patients' parents will ask, can you have LASIK when you're older? Yes, they can, but it doesn't actually cure their myopia, so to speak. I mean, it makes them free from their glasses or contact lens. So yes, it can actually help them, but not when they are young and the power is not stable yet, only usually beyond the age of 18, or better still after they're 21. And don't forget that the eyeball is still a short-sighted eyeball, means that it's still, if you're, let's say, 700-800 degrees and you do your LASIK and you end up with nothing and you can see well, doesn't mean that you don't have all the potential problems that I mentioned, like glaucoma, retinal detachment, because your eyeball is already weakened. So what LASIK does, just corrects the front part of the eye, the cornea, so that you can see clearly without glasses or contact lens. Children should not or cannot have LASIK because the power is not stable, and usually after 18 or better after 21, like I said. So take-home message, really, I've been talking about myopia for the past half an hour. It is something that is a problem. I call it a pandemic of some sort because it is spreading all over the world. It's already all over the world, and it's getting worse, and our children are getting more and more short-sighted at a younger and younger age. In my clinic every day, I see 6-7-year-olds come in with 300 degrees, 400 degrees, and that's something that's not going to be beneficial for them when they get older. So you need to control the time spent with the devices. So wear glasses, control time spent with devices and near work, spend more time outdoors, be aware of things that you can do to control, like eye drops and myopia control lenses. And more importantly, talk to your child as they grow old, they understand more, make them aware of the dangers of being myopic to a higher level so that they are able to go and seek help early if they do develop problems. So if you want to come and see us, there are many ways. I think Facebook page, those that are already on there, drop us a line there, YouTube, Instagram, all that. We have that. We also have our online appointment system that I mentioned just now in the video. So this is downloadable in Google Store, in your App Store. Basically, you download this, you put in LEC Eye Centre. For example, you can just pick up, if you want to see me, you can just choose an appointment time, a date that's available, and you click on it, and then your name is in the system. Right now, we are also doing a lot of different things over the past 1 year. We have been delivering medications to a lot of our patients that can't come out. And at the moment, we are still not over the pandemic, and there are people that are still worried about coming out. But if you need eye drops or you need anything from us, give us a call, drop us a note anyway. We can also do online consultations. I've been doing that for some of the patients who have some eye problems that we want to talk about. And so different ways to reach out to us. So I look forward to lots of questions, hopefully, about all that I've been talking about, mainly about myopia. And thank you for your time.
Thank you, Dr. Lee. Very informative. I guess our attendees is actually pretty overwhelmed with your information inputs.
Sure, a lot of medical things, I think.
Yeah. So just wondering, anyone would like to unmute and ask Dr. Lee question, because just now I saw Saufan Park, is it? Or Saufan Park? Raise a hand during the presentation. So if you have questions, for the attendees from our Zoom, you can unmute and then you can ask Dr. Lee any question. If you don't have, I actually have a couple of questions asked earlier by Miss Chai from our online, by Miss Chai. Dr. Lee, can a baby born with a bad eyesight and then, like for newborn baby, like maybe 2 years old, how can they do actually, can they bring their baby to come and check their eyes?
Yeah, of course. I think we are able to see patients of all ages, young or old. There are different ways of checking a baby's eyes. Of course, they may not be the most cooperative, but we can even check power for baby's eyes, because we have our optometrists or the eye doctors can use an instrument where we can actually use a light to check the power of the baby's eyes. And a lot of the time, if we suspect problems that need to be treated urgently, we do have to maybe put the child under anesthetic so that we can do more examination. So there are always options. And first thing is to let us have a look and let us check what kind of visual behavior they have and whether there's anything serious that we need to really look into. But rest assured that we can check babies. So you mentioned newborn baby and 2 years old. So which is that? Newborn is not 2 years old.
I mean, within that range, from newborn and maybe around 2 years old, because they cannot able to respond, you see.
That's right. So you can check. You cannot check power for children that are non-verbal and expect them to do it the normal way and go them what's ABC 1 2 3. They don't know what's all that anyway. So we have different ways of doing that. And for babies, we have seen babies that have been born with problems like cataract or glaucoma, and what happens then they need surgery, and then after that they need glasses. So you can see, not common, you see babies with glasses as well, which is not a great thing, but it's still something that's possible, and we still have the means of providing that care.
Okay. Then, Dr. Lee, in this case, at what would be the best age for a parent to bring in their child to have an eye check to see whether they have this eyesight problem?
Yeah, good point. I think I mentioned just now a few things to observe, of course, when your child is, when you're interacting with your child, those things like squinting, tilting their head, blinking, or things like that. But usually I would think, when they're approaching school age, 5, 6 years old, 7 years old is when they're going to be using their eyes more because they need to learn in school. I think some of the schools, not all of them are actually good in the sense that there's some way of testing vision as well. So it's not uncommon for me to see a lot of parents that bring their child in because they say, oh, the teacher has picked this up, teacher has picked that up, which is very good because the schools are paying attention. But I would think the important period to remember is 6 to 12 years old. 6 to 12 is the period for which if the child is short-sighted, that's when the power can really climb very quickly. So excuse me. So you want to make sure that you're vigilant during this period. If they need glasses, you give them to be quick. If you have some way to control them, you will start the control strategies then.
Wondering any of the attendees would like to ask question. It can be any eye-related question, not necessarily about children. So you can ask any eye-related question directly to Dr. Lee. Don't be shy.
It's an open clinic. Yes.
Yeah. You can just unmute yourself and ask question.
Or type it in the chat box if you want to.
On the other hand, Dr. Lee, I think there's a lot of parents also been wondering, if let's say their child is wearing glasses, can they grow out of wearing or needing the glasses, as they grow up? Because they have this myth and this understanding, eventually they will not need it anymore.
Not common. Let's put it that way. Once they actually need glasses, then the chances are they're going to need it for foreseeable rest of their life. But if it's a low power, I've seen 75, 100, and then as they grow, somehow the eyeball doesn't progress in the normal way where the power goes up and up. I have seen children that now they don't need it anymore, but not common, unfortunately. So once they actually have short-sightedness, then more than likely they're going to need it.
Okay. We have one question from Natalie Chan in our Zoom attendee. How often should a child be receiving eye checkups? She says she heard twice a year. Is it sufficient?
Twice a year is sufficient, and some might say it's an overkill, depending on how old. I can tell you that a child's visual demands changes as they grow up because you will notice that initially, their world is usually as a baby, their world is only up to maybe around 1 to 2 meters around them because they are only interacting with the parents or when they get an nappies changed. So they start off around there, and slowly as the eyeball grows and they interact more with the environment, then they need to get to see further and further away. So it really depends how old they are. But on average, I would say at least once a year. I think when you hit the age of maybe towards school age 4, 5, or 6, at least once a year, that you should maybe be mindful of getting the eye tested, especially when they've been introduced to your phone, your YouTube, your babysitting device like that. You haven't seen my phone there yet. So we're always guilty of oh, take this because I got to do something, so please just look at YouTube. When they start doing all that kind of thing, you want to be sure that they're not short-sighted. So do that at least once a year. Now, for those of my patients that are now confirmed to be short-sighted, and we have started them on the control program, either with the drops or with the glasses, myopia control, or both, then I normally see the patients every 3 months. So every 3 months, I want to see, is their power changing? If not, is their eyeball getting longer? Because we measure the eyeball as well. Because they've been shown that the length of the eyeball is more sensitive way of seeing when the eye power is going up. So we do that usually when they're on the control program every 3 months. So it can be quite frequent and up to that. Now, once they go beyond the age 16, 17, 18, maybe they are more stable, then you can say that's like an adult, then maybe you don't need to see them often anymore. And again, it depends on the level of the short-sightedness they have. Because if they are already very high, then they are at risk of all the other problems, then you want to see them regularly as well.
Okay. Any more questions from our attendees? If no, I think I will ask the same question again during our live session, Dr. Lee, regarding the myopia control eye drops. All right. The myopia eye drops, any side effects, if they continue to use it?
Okay, like I mentioned, atropine, which is actually myopin, atropine has been around for a long time. They found that at a high dose of 1%, it actually causes the muscle to relax and the pupil to dilate. And that makes the vision blur. So that's why we can't use it, because it can control your myopia, but it blurs the vision, so it's not useful for the child. So the studies have come up with a dosage now is between 0.01 to 0.05%. So it's like very, very low dose. And they find that it can actually control. And the side effects, minimal. In fact, you don't get any blurring, you don't get any pain or anything like that. Those that, of course, you have instances where people may be allergic to the drops, and allergy, then you just stop using it and you can't use it. But really, very, very little side effects with these drops. And it's convenient to use just once a day.
Okay. Dr. Lee, we have a question from our Facebook live attendee from SN Chua. He said, "Hi, Dr. Lee. Is it a need to change glasses every year for my child?"
Well, your child needs to have the eye power check, firstly. If the power has changed, then of course you need to actually change. But you need to at least bring the child for a test every 6 months or every year to make sure that, number one, the power is not changed. Then the second thing is, of course, looking at the health of the glasses. Are the frames all bangkok already and it is not sitting well? Because, like I said, children can be rough with it. And what happens, the worst is the frame's not sitting well, then they're not seeing well through the lenses in the correct part of the lens, and their vision is affected. So the health of the frame is important. Hence, just now I mentioned about those durable ones are useful. And then the lens itself, besides the power, most of them will come in some sort of coating. So the coating itself actually helps to protect, and it can be anti-scratch or sometimes anti-fog and things like that. And that coating can actually be lost over time as well. So it's a useful practice. That's why to get your child to get the eyes checked with their glasses, because what happens then, everything gets looked at. Look at the power, look at the glasses, look at the frame, look at the lens. So then you will know. But as I said, you cannot say that definitely everything has to be changed once a year, because if it doesn't, it doesn't. There's some questions here.
Yeah, Wong Choi Yin, is it you unmute yourself? Is it you want to ask question or?
There's some in the chat box. I think should we look at the chat box first?
All right.
There's a question from Ainil.
Yes, Ainil. She mentioned, "Hi doctor, my son is 7 years old now, and his power on the right side is 1,002, left is 900. Will the power increase or decrease?"
Firstly, Ainil, thank you for your question. And I am concerned that at 7 years old, your child's power is extremely high. It is not going to decrease, I can tell you that. And it is very likely to increase. Oops. If your child has not been seen by somebody, or it should be, because at these levels of power, we need to actually check the retina as well to make sure there's no other problems. And really, if your child is not on some way of controlling, then you should think about one of those control strategies I was talking about. Because it's not going to decrease. It will only increase. At 7, he's still got a long way to go.
Yeah. Just to interrupt, I think I think Dr. Lee's advice to bring in your child to have an eye check, it would be good. And just an interruption, because to inform all the attendees who attended our webinars tonight, be it whether through the Zoom or through our Facebook page or YouTube page, you are actually entitled for a free eye screening. Okay, so you can either bring your child in to do this free eye screening. And then on that day, when you come in for a free eye screening, thanks to Alcon, we actually will give out this artificial tears eye kit, which contains of 2 eye drops. Okay, this is mainly for dry eyes. So you may click on the link. The registration will actually close by tomorrow by 5 p.m. So you don't have to rush. You can do the registration later. So if you don't manage to get the link after the Zoom, you can go to our Facebook page to get the link from the comment page there. All right. So Dr. Lee, there's another question from our Zoom attendee from Southern Park. How about hyperopia? Is there any suggestion for hyperopia if my kid is 8-year-old for now?
Okay, hyperopia I didn't mention because today we're talking about mainly myopia, but hyperopia is another refractive error, shall we say. So it's another focusing problem that the eye has. So there's myopia, there's hyperopia, there's also astigmatism. So what happens in hyperopia is when the actual eye is too short, what happens, everything gets focused behind where it should be, and you end up with blur vision, usually for near and also actually for distant as well. But there is no control strategies for hyperopia, unfortunately. But glasses, again, is what you need. But the glasses are different from the myopic or myopia type of glasses because the power now is to refocus in a different way to make sure everything becomes sharp for the child. The good thing, or I'm not saying that it's a good thing, but the likelihood of hyperopia getting less with age is higher. Why? Because hyperopia means that the eyeball is too short, and as your child grows, the eyeball will elongate. So very commonly is, let's say your child has hyperopia 200-300, it usually does come down a bit. I don't mean that it comes down to 0, but it usually does come down. But again, of course, it can also increase now. Increase because the eyeball changes shape in a different way. But there is, at the moment, no good way of controlling it, so to speak. And the strategies I'm talking about earlier were all relating to myopia because that is a more common problem.
Okay, thank you, Dr. Lee. Lo Tammy has a question for you, asking, when does a child eye stop developing?
Now, if you talk in terms of obviously the elongating of the eye or the actual progression of the power, if I show you the chart earlier from the myopic calculator online, so it shows that usually up to about 17, 18, that's when the most eyeballs will stabilize. But again, we cannot actually say 100% because I also have patients that are in their 20s, sometimes even in their 30s, and power is still fluctuating and going up. But on average, usually around that age is when the actual eyes stop increasing in power and stabilize. So that's why when we do start some control program for the child, we want to make sure that they hit that level of stability before we stop.
Okay. Anil, thank you that you brought your son to our center and the next appointment in May. Dr. Lee, back to the myopin eye drop, the entropin eye drop. Is there a fixed time frame or max time frame that the children have to apply this eye drop to make it more effective?
I think what happens is, as I mentioned, we tend to use the drops until there's stability. So we can argue that that's at 17 or 18, but without just fixing a year to it or age to it, we also look at the child individually. Some of them might stabilize early. When I say stabilize, maybe or over a 3-year period, you find that, the power is not really changing anymore. They've just stayed there. Then we can think about maybe stopping the eye drop or maybe just relaxing a little bit and seeing whether the power will go up. Now, the studies that I mentioned earlier has also shown that if you stop too early, sometimes the drops, you think that, you're doing well. And after 1 year or 2 years, which is a bit too short to see the change, you stop, then they can get what we call a rebound. So they get a rebound in the power, will shoot up again. So normally we go for about 3 years and you see that the power is a bit stable. Then you say, okay, maybe we can think about stopping the drops and see how.
Okay, thank you, Dr. Lee. Any more questions from our attendees? If no, then I think we will call it a night. So for those attended our webinars. You're entitled for a free eye screening. Remember to click register from the link. And then for your information, our next webinar is on the 20th May. It's also at the same time. It's on a Thursday at 8:30 p.m. By Dr. Lee Meng Hock. We have Dr. Lee Meng Hock in the house with us in a Zoom now. So the next topic he will discuss about my contact lens making my eyes red. So for those who are a contact lens wearer, so you should join our next webinar. So thank you, Dr. Lee.
Thank you, everyone.
Thank you, everyone.
Thank you for
Should we have a
group photo?
Yeah, the group photo. So
Yeah.
can you all please
People might still be camera shy.
turn on your video? Shall we turn on the video? Come. 1 minute to make your hair nice.
I put makeup as well.
Ready? Anyone? Any more? Hi, Dato.
Hi.
Hi, Dr. Lim. See, we have Dr. Lim in the house. Dr. Lim, you are muted.
Hi, everyone. Sorry.
Hi. So next month on the 20th of May, we have Dr. Lim to share in our next webinar.
Okay.
Okay. So I will do a screenshot now. Smile, everyone. Okay, another screen, yeah. Smile. Thank you. Thank you, everyone.
Okay, thank you.
Good night.
Thank you all for
Good
attending.
night.
Good night.
Good night. Bye-bye.
Good night.